Overactive bladder is a very common condition. It actually impacts both men and women. The main symptoms of OAB are urinary frequency, or going to the bathroom more often than what makes sense for what you're drinking. Urgency, this really compelling need to go to urinate that you can't delay. Leaking or incontinence before you get to the bathroom, and getting up at night to void, we also call that nocturia. OAB, or overactive bladder, is treated usually with conservative measures first. We try to encourage patients to think about the fluids that they're drinking. We call that fluid management. Timed voiding is another very important conservative strategy that can improve the symptoms. Pelvic floor physical therapy is also very important in improving overactive bladder symptoms. When some of these more conservative strategies don't do the job we want them to, we will offer medication, and there are two main families of overactive bladder medications that are available to patients. There are some surgical treatment options for overactive bladder when the more conservative therapies don't work or when the medications don't offer good benefit. One of the treatments that we can implement is something called Botox. And you might have heard of Botox because of the cosmetic application of Botox. But actually, doctors of all varieties have been using Botox since the 1960s. In urology, we've been routinely using Botox in the bladder since the 1980s. For the first several years, this was reserved for people with spinal cord injury or people with defined neurologic illness. But in recent years, the therapy has been open for people with overactive bladder who don't necessarily have any other underlying condition. Another therapy for overactive bladder, when the more conservative therapies don't do the job that we want them to, is something called percutaneous tibial nerve stimulation. And it's kind of playing off the data that we have from acupuncture, where if you stimulate a specific nerve that happens to run behind the ankle bone with a little acupuncture type needle, it sends a signal up that nerve to the plexus of nerves that control the bladder. And that is called neuromodulation, and that has been shown to alleviate the symptoms of overactive bladder. This tends to be a treatment that takes just a few minutes, administered once a week in the doctor's office for 12 weeks. If patients do really well with this type of therapy, we then recommend maintenance therapy once a month. Finally, there's another surgical option for overactive bladder called sacral nerve modulation. This is a more direct stimulation of that nerve that communicates with the bladder, the third sacral nerve that communicates information from the brain down the spinal cord to the bladder and back. If we stimulate that nerve more directly, it helps to streamline that communication and serve as an effective treatment for overactive bladder.